I'm going to start today and talk a little bit about how a very small community-based partnered research project turned to a very complex, multi-sectored, system-wide food enterprise, looking at food waste and food insecurity. So the first slide is the acknowledgments. So this is okay, you don't really need to see this, but we got money from, that really did make this project work, was from Alberta Innovates, and student support from WICRI, and further support from the Edmonton Community Foundation. Look at that. Thank you. Okay. Okay, and this is the first time actually I've, presentations are always good to kind of get you thinking and going. So this is the first time I've presented this in this format. So I appreciate any feedback that you can give me. Okay, so there's my acknowledgements. So how we went from a maternal health research study, so that's pictured with that little blue dot on the bottom, how we went from that to that. And so I'm going to go through each of those layers and levels to say, when you get into this kind of community-based work, and you work with your partners, you don't know where you're going to end up. You can have your objectives that you wrote into the grant, but you really have to be open to going where your partners need and want to go. So it started with some funding from a research project, and we called it Enrich. And it was, the grant was formally to promote appropriate maternal body weight in pregnancy and postpartum through healthy eating. So we got a few $1 million to do this. And one of the parts of this maternal health project was to look at healthy eating in people who were living in vulnerable conditions. So Mayra, there she is, worked on her PhD in this context. So she and we partnered with the multicultural health brokers. I'm sure many of you are aware of the Multicultural Health Brokers Cooperative. They do a lot within our city supporting immigrant and refugee and asylum seekers, but really emphasize work with pregnant women, young mothers, and children. So they're brokers. They were created themselves to broker between newcomers, issues and cultures with our systems, with Western systems, schools, healthcare system, etc. So Mayra and Jessica, who was hired on the project, worked with the multicultural health brokers and primarily with some brokers from Northeast Africa. And when we went and did this work, the study objective was promote appropriate maternal body weight. The reality was that within the community, they didn't really want to talk about appropriate body weight. It was food of any kind was needed. There was a lack of same-day food for these women and their families. They had severe food insecurity. They did not have food in their fridge today. So it wasn't about eating more broccoli, as that picture prompts me to say. It really was just any food. We needed food. So that changed a little bit of the direction, of course, of our project. Indeed, this was out of 200, we did, Mayra did focus groups and one-on-one interviews, but also 213 surveys. And this is what came out, just to show you the severity of food insecurity among our families at the Multicultural Health Brokers. And you can look at the bottom one there that in some of these families' children, a third of these families' children not eating for a whole day because there wasn't enough money for food. So the grant allowed for an intervention. You were to do some research with some findings, then you were to put in an intervention, and then evaluate the intervention. Our intervention was, let's hire somebody called a community resource coordinator and let her figure out how to deal with this. Community resource coordinator, Sandra, there she is. So Sandra was hired. We decided it was May or June of 2016. And she became the point person and find solutions to lack of same-day food. And I'm really cautious here to say this is not about food insecurity, okay? It is crisis. We're in crisis. And so Sandra worked with the families, talked to the families, hung out, and kind of talked about what's worked in the past, what hasn't worked in the past, what have you guys tried? And she came up with a food rescue program. Sandra, do you want to add anything? There. Okay. She came up with a food rescue program, and she called it the Grocery Run Program. So it's a food rescue initiative where we set up a distribution once a week, and it's rescued foods. And I'm really sensitive to the word donated foods as well, because then it gets into people thinking about charity, and it is not solving the root causes of poverty, I'm very aware, but it's not when you're walking out of Safeway or Superstore putting something in a bin for the food bank kind of idea. It's foods at the end of the day that cannot be sold, that are put aside, but that are still very edible and delicious and okay to be sold or to be eaten. So we're very fortunate that Sandra was in the food space in Edmonton. So she was very able very quickly to get up, to make some phone calls, to get people on board and donors on board to provide us some food. So we started the Grocery Run program at the Edmonton Intercultural Center, where there's lots of community-based organizations in the one space in Macaulay School. So this is where people naturally come for service, for kids basketball, for programming, because you hear a lot about stigma when you're accessing services. So it was a natural place for them to come, so it reduced stigma about needing food and the barriers to access. It wasn't getting on a bus and going 3 bus stops to a food bank. We were able to secure volunteers, wonderful volunteers, readily because the U of A Alumni Association, I was in a meeting with a person and they said, hey, our alumni would love to be involved. So immediately we had numerous, reliable volunteers to pick up the food and drop off the food, and people to bag the food and get it ready for the families. So Sandra's position was from June 2016 to March 2018, when, so everything was great. Everything's wonderful. We're doing this little grocery run project. And we did a small evaluation because that was part of our bargain for the research. Do the research, put it in the intervention. How's the intervention working, the grocery run? So as you can imagine, not only did it provide food to families, it benefited the multicultural health brokers a lot, was a relief for us workers, because they spent so much of their time one-on-one with clients trying to get food for them when you work with crisis and you respond with let's deal with the crisis. So they spent so much of their time trying to get food for their clients. Just having that there was a huge relief. A bit of social cohesion. If you couldn't pick up your hamper, there was a network of other women that might deliver it for you, or other brokers, and just that notion of hope. This is one of our MACE graduate students, Jury. She was hired to do this evaluation. So all was fine except we ran out of funding and we had to cease Sandra's position in March of last year. So in the meantime, we're patching this together, and one of her volunteers stepped up to coordinate the program. We had over 100 hampers being prepared at that time, weekly, and we had a waiting list. We were stable at about 4 consistent food vendors, but our demand was very much outweighing our food vendors who we had. We were trying, although this was such a haphazard period, to secure additional partnerships. But of course, as you can all imagine, there's fear of liability if I give this food and somebody gets sick. There's also the concern about increased operational burden. Okay, you're going to come to my store and you're going to send a volunteer, but then, are you going to start sorting through stuff, and do I have to be there, and I don't have the time and I don't have the staff, those kind of things. But at this time, I was hearing about an organization called Leftovers, and Sandra had known about them for a little while. And we were hearing about Leftovers in Edmonton, but we didn't, nothing was really happening. Leftovers is from Calgary, and it's a well-functioning food rescue organization. So I picked up the phone and I called the director, and I said, we're kind of doing something similar here with food rescue. I've heard you're doing stuff in Edmonton. Is there any way we can collaborate? There's, the last thing we need in the not-for-profit sector is more empire building. Let's coordinate. And she said, oh, this is great. This is wonderful. They'd been trying actually for 2 years to get going in Edmonton, and for lots of different reasons just could not get off the ground. So we partnered with Leftovers, and these boxes are kind of to demonstrate how wonderful the partnership was. Leftovers needed somebody on the ground, someone with Edmonton-specific knowledge, and they came with a model of a citywide food rescue system. They had existing partnerships with food vendors in Calgary, with the same food vendors in Edmonton. They had a brand. A lot of people recognized their brand. With Grocery Run, our assets were, we had a community resource coordinator with the capacity on the ground to build this. We knew people, we kind of had all of the connections. We already had our little small-scale food rescue operation going, but we needed to scale up. We had a huge demand and we needed to scale up. So we partnered, and we were able to hire a new CRC. That's Morgan Allen, who's in Calgary right now for 2 days with Leftovers. And we were able to hire her in August 2018 with a little bit more research funding and funding from Edmonton Community Foundation. So by partnering, we increased the quantity of the food. We were donated, people just kind of, lots of anonymous donors, but say, here's a fridge, what do you guys need? We'll give you, you just get a check in the mail for $1,500. You don't know where it's come from. Okay, let's buy a fridge. So we can stock the fridges throughout the week, and allowed more sustainability of the grocery run. The Leftovers had a whole system of setup for volunteers, all done on the computer, where you just say, we need somebody to do this run. They log in, they say I can do it, and they had so many connections for fundraising. So it really helped with our sustainability. Okay, so we went from August 2018, 4 routes per week and 4 vendors, to April, to over 20 routes a week, over 10 food vendors, which is our business partnerships, and we're delivering now to 7 food agencies. So I want to be able to tell you, because I couldn't put it on the slide. So the businesses that are now donating to us are Save on Foods, 4 locations, Blush Lane, Planet Organic, 2 locations, Organic Box, Little Potato Company, Cobb's, 3 Italian Center locations, Transcend Coffee. Starbucks is going to be the first location in Western Canada that is supplying not just their pastries but their lunch boxes, those hard-boiled eggs and fruit things. They're going to start doing that. And we now have a relationship with the 124th Street Market for a pickup on a Thursday once a month and a Sunday once a month. And the service agencies we're working with, so of course multicultural health brokers get food delivered, but Youth Emergency Shelter, Urban Manor Housing, Pregnancy Pathways, Adira, Operation Friendship Senior Centers, and Boyle Street we're now delivering to. So there's also, though, part of this is the local businesses, of course, are eager to support local. And so these guys, for example, the Studio B Fitness, they will, and same with the Yoga Life. There's a karma class and you can go and pay anything you want for the karma class for yoga on Friday night, and we get the proceeds from that. So one of those brought in $4,000. Tycoon Events is an event planner. They give some of the proceeds. When you check out at Spud, it's an online grocery store, when you check out at Spud, you can donate to the grocery run. So there's lots of these Blush Saturdays. Blush Lane provides us one Saturday a quarter, where when you check out, they say, oh, do you want to donate? And people donate. So we get cash through those kind of businesses. And those have all come to us as far as we haven't gone out and actively tried that. The role of the U of A has been phenomenal. We could not have started or sustained without the alumni volunteers. Faculty of Extension stepped up at Christmas time when we were struggling a little bit with a fundraiser to get us through Christmas. We have a mentorship program with AILS that 20 students are involved, CSL classes, another 20 students, and of course researchers at the U of A. So the U of A has been a major partner in this. And lots of community, faith groups, citizens groups. Hi, can you come and do a presentation? So the word gets out that way. So we do a lot of that. And I have funders there because Edmonton Community Foundation as a funder is not just interested in here's your money, report back in a year or 2 years. They are very active in how does this really contribute to social good, and want to be involved in promoting that. And then at the advocacy level, this is where this is just starting for us. This is Mary's context. This is where Mary works in, right? But applying, Morgan is now applied to be on the Edmonton Food Council, which, Sandra, you're chair of, right? Co-chair of. Alberta Flavor Learning Lab, which is Mary's. Apathy is Boring is an organization that works with young people to be more involved in democracy. So they've contacted us to say, can we do something with you? So we're just kind of getting to this layer of people saying, how can we work together? And of course, the policy level, there's lots of implications at this level. Food waste policy. I got into this because of my work with, of course, the grant, but also with End Poverty Edmonton. This made sense for my scholarship in the Faculty of Extension. I know the work of those advocacy organizations in Food Policy for Canada. Aaron Paquette, as a counselor, has the food initiative. So we're working with him and his staff about what the implications are at that level. And then this is something that I think is, things happen, I think, timely. It was timely. This thing happened and got off the ground and was able to build from that little purple to this because food culture and food is now being talked about a lot. Sustainability, climate change, pop-up markets, pop-ups, food waste. There's a huge initiative with the city, if you're involved in any of that, about food waste and poverty. So I think a lot of this is not really, it's just the timing. The doors opened because we are a lot more attentive to these kind of issues because we hear about them all the time now. So I think that always has to be acknowledged in any of our successes about what's kind of being talked about outside of our own circles. So what's next? Now we're finally actually getting into the food insecurity piece. So we're trying to get a community mobile market off the ground. This is Calgary's. And we're working with the CDC, the Community Development Corporate Company. They were a corporation, now they're a company. So they're looking at neighborhoods and building healthy neighborhoods. And Jasper Place Wellness, they already have community mobile markets. And the city, we're looking at the city. Calgary has gone to plans of, were able to purchase city buses, decommissioned city buses for $1 from the city, and then they get their SATE, our NATE students, to re-engineer the buses so that there's baskets and things down the aisles. They get retired city bus drivers to drive the bus, and you drive into housing complexes where low-income housing complexes, senior complex, people where it's hard to access good, healthy food. And so we have people here that will sell us the produce at cost. So we just have to now get going in Edmonton. So that's what we're trying to do next in our initiative with leftovers and the grocery run. And going back to the multicultural health brokers, though, because that's where we started, another student, a social work student, worked on a spectrum of food security strategies over a summer project, and was looking at kind of where the multicultural health brokers are going to try and put some of their efforts and work with their families. Their families really want collective kitchens, those kind of things. So this was her piece, and I wanted to share that, where you go from truly crisis food bank, grocery run programs through to where you're able to purchase discounted groceries. So that's kind of back at the multicultural health brokers. So these are multicultural health brokers, and there's a picture of Sandra there. That looks like one of the hampers from one of the days, way back when. And that's that.